Hi, my name is Kelsey. I'm in group 2 and I'm going to be discussing failure to thrive today for the Pedi project. So my first slide here is going to talk about the definition for failure to thrive. So failure to thrive describes infants and children who, with or without an obvious cause, fail to gain or to lose weight. This condition can be caused by physical, which is organic, or pathological dysfunction, such as congenital heart disease or malabsorption syndromes. There's usually a lack of parent-to-infant interaction that can result from the environment factors, which could be neglect, lack of information concerning the nutritional needs of the infants, which is non-organic failure to thrive. So the parents aren't meaning to do any of this. Most of the time they're just not educated enough to know that their children need more than what they're doing. So the next slide, I have some assessment findings. So generally the infants who fail to thrive are admitted to the hospital for further evaluation just because they know something's going on, but they're just trying to figure out like what exactly is going on. Some of the signs and symptoms could be weight loss or failure to gain weight. They could be irritable, disturbances of food intake such as anorexia or pica, and pica is just the abnormal consumption of non-food materials. They could have nausea, vomiting, diarrhea, general neuromuscular spasticity. So their muscles are spasming because they're just so dehydrated that, they don't have the proper nutritional needs that they need. Oftentimes these children fall below the 3rd percentile. Sometimes authorities suggest the 5th percentile and weight and height standards on growth charts. So when they go in for their well-child checkups, obviously it has the growth charts and stuff, and you're going to notice that these kids normally fall under the normal growth patterns for their ages. Some of the children may have a ragdoll limpness, while others may appear stiff and unresponsive to cuddling. So since that parent-infant bonding isn't there, oftentimes when they're irritable and you can't get them to calm down, even cuddling is not going to help because it's not someone that they trust and care for, because the nurturing is just not there between the caregiver and the infant. So they're just very uncomfortable with the situation and nothing really helps them to ease that. So here are some pictures. So as you can see, the dad on the left side, the dad seems frustrated, like they can't figure out what's going on with the child. He might not know how to figure out, because oftentimes with children, there are ways to kind of like figure out what's going on with them, or just little different things that you can do to try to see what's going to alleviate pain, if they're even in pain, or if they're hungry, diaper change, those kind of things. And sometimes parents of first-time children, they don't know that, so you need to go to like classes to teach you how to do those kind of things. And this over here is just the normal growth chart. So this one's for the body length and weight, and this one's for head circumference and weight and length. So you can tell that most of the time they fall underneath the normal growth charts for children of their age, pretty much on all the scales. So some of the manifestations with the failure to thrive, there's normally a disturbance in the parent-infant or the caregiver-infant relationship, like I was saying. There's often some factors that contribute to the cause of this. Normally it could be alcohol and drug abuse that the parent is doing, but some of the uncommon ones are the obvious neglect and physical abuse. The children come in with bruises, or you can tell that they're scared or nervous. The infants also suffer from the inability to establish a sense of trust in their own caregivers. And if they cannot trust their caregivers, the person who cares for them every single day, then who are they supposed to trust and have a sense of bonding with? So like I was saying earlier, if you can't trust who's taking care of you, then you're really not going to be able to trust anybody because you don't have that trust bond situation with your caregivers. There's ways to prevent this. Some of the environmental failure to thrive consists chiefly of social measures such as parenting classes, family planning, early recognition, of course, and a support for families at risk. Early detection obviously helps a lot more because the sooner you find out about it, the easier it is to treat it. There should be a routine health assessment done on the child. Also, when you obtain the pregnancy history, it's very important because it can contribute to the lack of bonding, such as an unplanned pregnancy or desertion by the child's father. So you can kind of, when you're doing that, you can kind of figure out if the pregnancy was planned, because oftentimes if it's not planned, sometimes that caregiver-infant bonding is not really there. Not to say that it won't ever get there, but it's just a very touchy subject for now because of the fact that it wasn't planned. You know, they might not be on their 5-year plan goal that some people have, but it might eventually get there, and sometimes it doesn't, and that's whenever we have to start figuring out what we can do for the child and for the parent, and most of all, the child's safety is what's going to be number one in this situation. So we have some treatment plans. The treatment involves a multidisciplinary team as to a lot of things. Normally the team includes a healthcare provider, the nurse, social workers, family agency, a counselor. Unfortunately, if there's no progress can be made, sometimes a temporary or permanent placement of the child or children in a foster home may be required. Obviously, they try to stay away from this, but you know, sometimes it happens. Treatment of a child who fails to thrive requires maturity on the part of the nurse because it's vital to support rather than to reject the mother. So in these situations, instead of judging, instead of pointing fingers and blaming, you're really just wanting to help support the mom and the child, of course, because those are the main priority in this. As of always, listening and helping the mother to understand her feelings and frustrations at this point is very important. You also want to encourage the mother to help in all the ADLs of her child to build that relationship, because the more the mother does, you know, she starts to figure out that she is the person that's taking care of the child, like the child can't take care of itself. So the more you interact and you're able to do things for the child, sometimes that closer bonding can start to develop. So the prognosis of this condition is usually uncertain because everybody's different. You can't really predict how everybody's going to act, and every situation's different. So emotional starvation, particularly in the early years, can be a psychologically traumatic. Inadequacies in intelligence, language, and social behaviors have been seen documented in children who fail to thrive. So these children are going to have learning disabilities. They're going to struggle in school, probably social events. So the main thing is just to help them get to where they need to be to learn and to grow and have those trusting relationships with at least somebody, specifically an adult, that's going to help them, or the child knows that they can come to them whenever they need to, and that kind of stuff, just because, I mean, you don't ever want a child to think that they don't have somebody to go to. So that's going to be the end, and then I just have the resources, and I found all this information out of the book. So I'll see you in my project. Thank you.